Blood is in between two glass slides. I did not put any stain or any chemical in your blood.
Okay.
This is 10 times magnification. Later on, we're going to switch to 50 and 100 times so we can see the structures of the cells. And I'm also taking pictures. I'll give you copies.
Okay, excellent.
Now, these are the red cells. The red cells are the one that gives us oxygen and nutrition. Your red cell looks good, although there are some that are on top of each other, which is an indication that possibly you did not drink enough water today.
Okay.
So there's a little bit of dehydration, poor circulation.
That would be accurate. I haven't drank as much as I usually do today.
Aside from the red cell, we also have these white cells. So they are the soldiers of our body. They fight infection. For every 500 red, you're supposed to have one white. And in this frame, if we have 5 or less, it's okay. So let's count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 16, 17, 18, 19.
That's bad, huh?
Well, that means your immune system is producing white cell because you are fighting something. Maybe it's an infection or allergy. That's good. That means your immune system is,
Responding. Okay.
So that's 18 neutrophil and let me see the lymphocyte. 1, 2, 3, 4, 3 lymphocytes. Okay. Now let's go to higher lens so we can see the structures of the cell. I just need to put a drop of oil on top of the slide. Okay, this is 50 times magnification. These jumping around are the lipids, cholesterol, triglyceride, or if you just ate the fat of undigested food.
Okay.
Now the red cells should be round. If we see red cells that are pointed, that is an indication of allergy. It can be food allergy, can be pollens, animals, molds, or chemicals. Now, red cells that looks like a rolling ball, has a rolling ball inside like this, that's an indication of liver stress. Liver is our main filtering system, so your liver is still working, but it needs to be detoxified. Are you taking any prescription medicine?
I stopped taking my prescription medicine about 2.5 weeks ago.
Okay.
It was just making me sick. I could no longer tell if what I was experiencing was symptoms or side effects.
Or the side effects, okay.
So I just
That's
tossed
why
them.
you also have this, looks like straw. So that's an indication also of toxicity. Sometimes it's from the prescription medicine or the environment, the water, the food preservative like that. But your liver is still working, but it needs to be detoxified, and the doctor will let you know
Okay.
the procedure for doing that. Now this is a neutrophil. It is a white cell that fights bacteria.
Okay.
The granules inside are moving, so that's a good sign it is working. Now
Go ahead.
these are platelets. We need platelets so that when we are wounded, the bleeding will stop. But we don't want a lot of platelets because that's an indication of inflammation, especially giant platelets. Okay?
Are those giant?
No, these are
Okay.
good normal size.
Good.
Giant, you see it's as big as the television.
Oh, wow. Okay.
And it depends upon the age of the patient. Usually, if we see a lot of this straw and we see a giant platelet and the patient is an elderly, I have to notify the doctor right away because that means the patient is a candidate for stroke or blood clot.
Okay.
Okay, now sometimes around the platelet, we can see these circles or bubbles. There's some in here also. That
Okay.
is an indication possibly of candida or yeast infection.
Okay.
Patient who has taken antibiotics and they did not take any probiotic or acidophilus.
I've been
then-
taking a lot of
yeah.
probiotics, but I was on antibiotics for 10 months straight. This is the longest break
Oh. Wow.
I've taken from antibiotics since I started back in February.
Well, if there's an overgrowth of candida, I will let you know.
Okay,
I
great.
I can see if there's
Okay.
an overgrowth. Okay. Now this one I'm going to put in 100 times so you can see this cell. Okay. This is another white cell. This is called the lymphocyte. It is a white cell that fights viruses. Now, in the dark field microscope, since we are not using any stain or chemical, we cannot really identify the virus. But there's an indication that this particular cell is fighting some viruses because this is the cell, and this circle around is called viral encapsulation, which means it's fighting some viruses.
Okay.
Now, also, if we see cells that are abnormal in shape, it's not really round, that's an indication of oxidative stress or lack of oxygen.
Okay.
Now, you should remember that you came from
Florida.
Florida, and it's a sea level. Reno is higher elevation, our air is thinner.
Mm-hmm.
That's why some patients, when they come here, they said they cannot breathe.
I felt a little bit of that on the
Yes,
plane.
because our air is thinner.
Uh-huh.
Okay? So when you are walking, just bear in mind you have to really breathe
Deeper?
deeper.
Okay.
Okay, now also if you notice some of your cells are bigger than the others, that is an indication that your body is compensating for the elevation. Your
Okay.
body is producing more hemoglobin because of the oxygen.
So that's good.
Yeah, it's good. Your
Okay,
body's
good.
fighting. You're still young.
Yay!
But you have a lot of this, candida. Yeah, the circles around.
Okay.
What is your diagnosis? Is it Lyme?
Yes.
And you've taken antibiotic for...
I've taken antibiotics for 10 months.
Wow.
I definitely feel better, but I feel like I've plateaued, and like I explained earlier, I couldn't tell if I was having symptoms or side effects anymore.
Do you have any co-infection of Lyme?
I've never done Lyme co-infections, but my doctor tested for Mycoplasma HHV6, and I think it was like C. pneumonia.
Yes. So this one, see this inside? That can possibly be a co-infection.
Okay, so that's what he said. He said that my levels for Mycoplasma were like 10 times what they should be, and same for the C. pneumonia and HHV6. I think it's C. pneumonia. I could be wrong.
Mycoplasma usually is round, floating around or inside. See this one, we don't know if it's inside the cell or it's just on the outside.
Underneath.
Yeah, underneath like that.
Is this magnified enough to be able to see spirochetes if they were in there?
Yes. Yeah,
So we don't see any?
Well, we have to look around. What I usually do is introduce the different cells to the patient,
Okay.
and then we will look around for any spirochete.
Okay.
Now this one is another type of white cell. This is called eosinophil. See, these four are neutrophil that fights bacteria. Eosinophil, if the patient has a lot of those, the patient possibly has a lot of allergy, sensitivity, or the patient has parasites. Now we don't do the counting here. The laboratory does that.
Okay.
But that's how the structures is very different.
Okay.
And actually, this is colored yellow.
Why would it be yellow?
That is the characteristic of eosinophil.
Of what?
If you look in here, it looks like it's yellow.
Okay.
Yeah.
And what does it mean?
That is the characteristic.
Oh, it's supposed to,
Yeah.
okay.
Yeah, it's supposed to be like that.
Okay, good. Okay, no, I got it.
Okay, now let's see if I can find any.